Hey y'all, this is Deidra here with Deidra Daydreamer coming at you with a new video. And if you like this video, please click like, subscribe, and share this video with family and friends as I am trying to grow my channel. And with that being said, today is Mental Health Monday, and so let's get into it. I would like to give a disclaimer. I'm not a doctor. And I do always recommend a second opinion, especially if you are having second thoughts about maybe something your doctor has told you, or if you are going to undergo a procedure of some kind and you feel like you need more information. Please do your research. And I also am not telling you that you should fire your doctor, but what I am saying is if you have any of these warning signs that maybe you should think about things and consider it. So, I'll just tell you a little story. First of all, I did not fire my doctor, but I found myself without a doctor in several cases this past year. One of my doctors moved. My doctor did not get replaced. He got replaced with 2 nurse practitioners. So I have a nurse practitioner instead of a doctor now. And the other one, was my mental health doctor. And after he left, I took his replacement, but his replacement just was unable to help me. She felt like I needed more care than she could give, and she recommended me to go to mental health. And so that's what I did. Although my mental health journey has not been smooth sailing, I did try to move from mental health to another provider. I could not because of the type of treatment I require at mental health. And so I'm stuck at mental health. Although technically if I had my choice, I would not be at mental health. I would be under another doctor's care. So I thought we would kind of research this topic. Do you need a new doctor? And here are some signs that you might need a new doctor. It could be a mental health doctor. It could be a regular doctor. It could be a counselor or a therapist. The top 3 reasons I feel like there are 9, but the top 3 I feel like they're the most kind of egregious, or you don't feel like you're being heard, number 1. So if you feel like your doctor or provider is not listening to you, and I don't mean just like on one subject, I mean like consistently not listening to you. Like I have this problem with mental health all the time. They don't listen to me, and then like 6 visits later, then they want to listen to me when I've been telling them the same thing since visit number 1. So, number 2, you can't be honest with your doctor. If you cannot be honest with your doctor and they cannot be honest with you, that is no way to have a working relationship with a doctor. You need to be able to trust your doctor and be able to disclose what you need to disclose to your medical professional. You feel bullied. If you feel bullied by your professional, like that is no way to be in any working relationship with anyone, much less your doctor. So if you feel like you're being bullied, you might want to consider getting another provider. So you have a serious personality conflict. I don't mean maybe the doctor-patient gap. Not like that. I'm talking about like personality just clash really bad. In that case, it may be warranted. Your doctor is too strict to serve you. So maybe your doctor is not being able to spend enough time with you in your visit. That could be a warranting. Your doctor's approach is not healing you. Now, this one I kind of was on the fence about, because I feel like when you go to the doctor, they're not really there to treat you, to heal you anyway. Like, I mean, under certain circumstances, yes. Like, if you have a UTI, they'll give you antibiotics and the UTI goes away. That's kind of a healing thing, right? But I mean, when you go to the doctor, generally they want you to keep coming back to them. Like, they don't want you to get to the point where you're so healthy and so just great that you don't need them at all. So that one I was kind of on the fence about, because most providers do want you to keep coming back to see them. They're not in the business of healing you to the point where you never need them. So that one I was kind of on the fence about. I was like, I don't think any doctor wants you so healed to the point to where you just like, oh, I don't need to go to the doctor no more. Most doctors count on you having to come every 6 months, every 3 months, 2 months, 1 month to see them. So I don't really think that's warranting that you need a new doctor. Like, I guess if it was really extreme, maybe. Your doctor doesn't educate you. So with that being said, like, doctor doesn't give you information about your disease or your medication, or the nurse doesn't. In a lot of cases now, the nurse will give you information or educate you on, like, how to wash your hands, how to care for yourself properly, those kind of things. So if the nurse in the doctor's office is not educating you on topics you need educating about. But I will say this, sometimes it takes you asking the question though too. Like, I always ask when I get started on new medication, normally, what are the side effects of this? What are some signs I need to watch for if this medication is harmful to me? There are questions like that. So you want to be proactive though, and ask those educating questions and be involved in your medical care too. So I will say that. Your doctor's too aggressive. Now, this one I wasn't really on the fence about, but I felt like your doctor would have to be really aggressive, or like just too aggressive. Not like in a normal doctorly aggressive way, or trying to treat your disease in an aggressive manner, but like it being like maybe a personality aggressive, if you get my drift. So that your doctor refuses to coordinate with your other specialists. I was a little on the fence about this. I actually found out something over in the last couple of weeks, actually, that my mental health professional was not coordinating with my family health doctor, and I really had not been having a problem with that, because my old doctor would send them my notes, and that's how they kept in the loop about my bipolar. And so I found out that mental health needed a release to be able to release those records. And then I also found out that my family doctor has to request those records every time I go to the doctor. So it kind of puts me at doing more legwork. I have to call the doctor, my family doctor, and get them to request the records. So when I go back to that doctor, they have my records. Now, in some cases, you are going to have to do more legwork. In my case, with the conditions that I have and some of the chronic ones that I have, I do lots of legwork for doctors. Do I feel like technically I should have to? Probably not. But if I want it to get done, I want my records to be in certain offices or what have you. I have to do the legwork for them and make sure that my records are getting where they need to go. So with that being said, I'm very curious and would love to know. Leave me a comment in the comment section below. Have you ever found yourself without a doctor and needing a doctor because you lost your doctor due to some unforeseen circumstance? And what was your story like? Have you ever had to fire a doctor? Maybe you've had to fire a doctor. Or maybe you found yourself having to find another doctor. If you could leave me a comment in the comment section below and tell me your story, I would love to hear it. And so I hope that you are not having doctor problems, but if you are, I hope this gives you clarity and helps you to make a final decision on whether or not you should get a new doctor. And with that being said, dream big, Deidra's Daily Dreamer. Dream big. Bye-bye.